Dentistry is a fairly young and modern science. In Germany, the first scientific training places for dentists were set up in Heidelberg, Berlin, and Leipzig in 1884. Before that, it was turners and umbrella makers, sometimes ivory carvers, who made artificial teeth. But also total amateurs worked as tooth extractors. They worked at fairs and markets, extracting right across the country. Had people been aware of the failures in their activities, they would have made themselves scarce. This is what early dentures from about the year 1500 looked like. One could certainly not have used them for chewing. The raw material used was an ox bone. Complete dentures made of ivory date from the first half of the 19th century. The clearly visible tobacco stains and the signs of wear still show that they were used for a long time. In 1840, the first factory-made artificial porcelain teeth came onto the market from England, which, from 1860, were, together with vulcanite, just invented by Charles Goodyear, made into dentures. Those were the first dentures which, to a certain extent, the citizens could afford. Today, the most modern materials are available for the production of complete dentures. An important aesthetic consideration of complete dentures is the shade of the teeth. That's why prosthetic teeth are available in many different shades, from light to dark according to the patient's age and in countless tones. But such light tooth shades, as shown here in the young teeth of a 14-year-old girl, have an unnatural effect in middle-aged patients. Equally important, if not more so, is the choosing of the correct shape of tooth. This example shows how varied similar-sized rows of teeth can appear with the choice of different shapes of tooth. The making of new dentures is undertaken by the dental technician. This skilled job is, by the way, often also carried out by women. The taking of impressions is something that most patients can only bring themselves to accept with some difficulty, for the dental technician needs an exact replica of the proportions of the mouth in modelling plaster, so that the denture fits the palate and/or the jawbone well and has good suction. The impression is indispensable for this. Then, the front teeth are arranged first of all, and the back teeth are placed adjacent to them. A useful piece of apparatus made of metal, this is called an articulator. It enables the dental technician to simulate the chewing movements of the patient's mouth whilst working on the new denture. Then, of course, one can not only look nice with the new denture, but also chew well. A shrunken pair of lips is often evidence of toothlessness or the unsuitable setup of the rows of teeth in a complete denture. The correctly set up denture supports the lips like this. The finished denture is not recognized quickly by anyone. That is particularly the case where the manufactured teeth show, by means of individual adaptation, all those characteristics that correspond to the age of the patient, if they clearly show signs of wear and use. Such extensive characterization may possibly cost more. If you can eventually laugh, talk, and eat well like this with your new dentures, then your dentist has performed a small miracle. Such a miracle, however, requires good cooperation between the patient and the dentist, particularly when, as sometimes happens, the proportions of the mouth are unfavorable for denture treatment.